very big.
Morning, Maze.
Morning, y'all.
Hey, mate.
I like AEMT.
And down the best shaker I've ever seen. It's not like I got
Yeah, you probably wouldn't happen to have any extra gators for y'all.
Extra what?
Gators.
I don't think so. I'll see though later. Okay, I'll get you a mask.
another dude that worked there. If I was working, and you was
Grapeseed oil?
working, I was
You guys talking about?
we could go out there together.
Yeah.
If I was there, I'd clock him in for 4 hours.
I used to date a girl that liked grapeseed oil.
What was her name?
Danielle.
We ran it for probably over 6 months.
Love of my life. Oh, she didn't put it in her
Plus,
hair.
an extra 25 hours a week on it. It's getting good too. We wasn't even in for 5 hours. It was 20 extra hours a week. They had a GM come in. Full time sheets.
That's what she used to do.
And then they call it. So then they went back and looked at the camera and said, all right, you got it.
Live on YouTube.
But not for that random DM company. I think with transfer.
Oh, yeah, at least a year.
Thanks for the show, instructor.
All your 800 followers are left.
I know, man. They're that's pizza, man. That looks like pizza, dude. No, it's toast. Yeah.
I watched that video. Class online, like going over the boards. It was so weird. I was like watching that, like,
He is just staring at my toes.
judging us while he does
I wonder what he has on.
it. I was like,
Get in, big poop.
Maze, how's your morning in Boulder Crest?
off the hand.
Average. It's pretty good. Just a couple of gunshots. Not too bad.
Glad to hear it. Glad to hear it.
They just got windows.
They didn't have windows. They did not have windows. Yeah, they found a way. There's one up there in that. No salt.
You the whole.
You might be here. Used to play on the basketball. Play team, be so high. Didn't like kind of email. Yeah. You get $50 to get your
Oh, wow, $50.
More than I got. $45 more than I got.
You got $5?
I got $5 gift card to Target.
Wow.
$5 get you a Target.
I gotta put it in.
I'll have to give me a man.
I got 15 Amazon. Just forget what. American Red Cross.
Only got 20% that Amazon.
I need all that. And I had to upload anyway. I wouldn't pay them.
That's going good.
Hey, that's it. What? Oh, it's a
Oh, you're talking about donate. Yeah, no, there's a place on Peach Street in Atlanta that's $100 a pop for 400.
Oh, yeah. Look who's sitting next to us.
1,600 bucks. Bro, for nothing. I can do that in 2 minutes somehow.
Don't say that ain't even that hard.
It's 2 minutes work.
How long it actually takes to process.
I know, I've seen it.
It'd be kind of weird though.
The first time, I'm sure it takes a minute. After that, I'm pretty sure you can go in and tell you it's in. You know what I mean?
Oh, that's kind of weird. To think about having a kid somewhere. You know?
You want to ride down there together? That's not weird at all.
I'm gonna remake that.
Huh?
Want to shut her up?
I'm for it.
I don't have I'm going on YouTube.
It's funny. Hey, so intravascular fluid is essentially water in the vessel. That's really all it is, right? I love that. Just like I tell them, like early 3 in the morning. I mean, because it's a 1% of blood. It's down to the blood vessels.
Pages on.
0.5%.
Pages on.
On the, what's the first page of the old one? It's under ECF, paragraph ECF. I mean, it's just fluid portion of the blood. Now within the blood vessel.
Yeah.
It's masked by water in the blood vessel. That's it. Seems so, it seems like it's so intense. Water in the vessel.
Yeah.
Good morning, Zoom.
Good morning.
How's everybody this morning out there?
Doing pretty good.
Good,
Deal. Y'all hear me okay, I guess?
sir.
All right. All righty, so, anything about what we talked about yesterday? I feeling pretty good about acid base. All right. For the most part. All right. Deal. All right, so the plan is today to talk about chapter 8. We're going to talk a little more about cell. We'll talk a little more about acid base. We will do that for the morning part, then we will come back and do a test review for our exam tomorrow. Sound good? All right. All right, folks in Zoom world, hang on 1 second. I got to download the PowerPoint real quick. Yeah, I sure will. Yep.
You don't even have to listen to it. All you gotta do is put it laugh. Yeah.
Know the difference.
Yeah. Pruitt is here over blood vessel. Yep. What is it? The heart sounds.
Dude, I forgot.
Whooshing like. Murmur can be benign or heart disease. I think Pruitt can be like atherosclerosis. Do I have that right?
Just say it wasn't.
Isn't that, it's like a lead calcium or something?
No one's ever gonna watch.
Everybody in Zoom, can y'all see the PowerPoint?
I don't think it's a lack of calcium. I think it's buildup of calcium.
Maze, can you see the PowerPoint?
No, we just got a screen saying that you started screen sharing.
Oh, it is.
He just has to talk sometimes.
Yeah, I don't.
He just has to say something. Whenever he's not talking enough, he starts spazzing out back there.
His parents never gave him enough
Jump
attention.
in.
His sister got all the attention. He's the child they never wanted. You guys are gonna make a lot of people cry.
They've already made me cry. Yeah.
He's like, "Oh, my God."
You wanna see it? I used to know you said it. I looked over this sheet. So, yeah. No, I looked over Alex over.
Did you?
PaCO2.
Can you see it now, Maze?
Pressure,
Not
No,
yet.
it's still a black screen.
CO2, yes.
yeah,
Pressure.
pH decrease.
Right? Yeah.
right?
Yeah. Daggers and monocytes, mono is only one.
All right, hang on a second.
Copy.
Mono? No. Okay, so all of this. Those first few questions are like. And then the rest of it after that. I didn't guess.
My dad was Sunday.
There we go.
Is that it?
That's
Yeah.
good.
That's good.
All right, man.
That's what I use. It's something that-
Oh, yeah.
That's what the big guy does. Because then you can eat anything. Anything. You can just eat all day. It gets straight into the cell and full of response every time.
All right, so we still remember that back in the cell, cells make tissues, right? Tissue makes organs, organs make organ systems. And so cells have a type of protective mechanism. It attempts to guard itself from injury. Okay, so we're going to talk about a few of these terms that are up here. The first one being atrophy. Now, a lot of times when we talk about atrophy, what we talk about is like muscle cells. And this is, you'll see it like if somebody ends up getting an injury to where they're bedridden for a while. Let's say maybe a fractured femur or some other medical condition that would lead to a person being in the bed for a while. And those muscle cells begin to shrink and they begin to reduce in size. And so let's say the person gets better and they want to walk again. Well, these muscles are very weak and they're very kind of shriveled up. So they have to, get physical therapy to help them learn how, not really learn how to walk again, but to start walking again, to start using these muscles in order for those cells to come back to where they once were. So atrophy is a decrease in cell size due to a loss of subcellular components. That's the book definition. All right, and so we can look then at our next definition, which is called hypertrophy. And so it's kind of the opposite of atrophy. So this is when a cell size is going to increase due to subcellular components. Okay, so this is when the cell size increases. And so your book kind of uses an example of a callus, right? A callus using like skin cells as an example. And so a callus kind of peels off. It's like real, it's like some of you guys might not know what calluses are. Y'all feel free to forget lunch. But for this, so for those of you who don't know, say you go out and start building something like a deck or get your hands on some wood and you're moving stuff, and that wood and stuff will start rubbing on your hand. Before long, it'll start giving you things called calluses. And it looks like a blister kind of. And so these, what happens is the cells come to the top of the skin. And so you have more of them and they're becoming larger. So then, which brings us to our next term, which is hyperplasia. And what this is just an increase in the actual number of the cells. And again, we can use something like a callus, for example, a skin cell that reproduces as skin, let's say you get sunburn. Well, that epidermis from the sunburn starts peeling, right? Well, skin cells from the skin start coming up to recover that with new tissue, right? So you have to increase the number of cells in that. All right, and so we can talk about our next one, which is called dysplasia. And this is when the cell actually, there's alterations in maybe the size or the shape and organization of the cell. And so an example here that we can use is the thyroid gland. Okay, so we can use a thyroid gland, and what makes the tissue of a thyroid gland is called epithelial tissue. And so the thyroid gland is made of that. You find epithelial tissue in most all glands because it's specialized. It allows glands to secrete hormones, right?
Yeah, epithelial, is that the same tissue inside the tunica intima of the vessels?
Yeah, probably so. Usually epithelial finding glands, veins, stuff like that, where diffusion occurs. So yeah, so all right, so you take the thyroid gland. Well, sometimes the thyroid stimulating hormone, TSH, will either be too much of it or not enough of it, and it will cause that thyroid sometimes to swell, and sometimes the thyroid can actually even alter its shape of the gland itself, and so that would fit that definition of dysplasia. Yep.
How is that different from? How do you differentiate dysplasia from hypertrophy? Also be, I understand that like ulcers.
Sure. So when we talk about hypertrophy, we're talking about the contents inside the cell. If there's more contents inside the cell, when we're talking about dysplasia, there's not only could be more content, but the actual shape of the cell can change. And then metaplasia. So this is talking about like the book gives a example of one adult cell type is replaced by another cell type. And so they're talking about, let's say you have epithelial tissue in your trachea and you're a smoker and some of that tissue gets destroyed. Well, some of that tissue can be replaced. When we talk about alveoli, that's a different story. That doesn't get replaced. There's some parts of the alveoli that can, and if you get real technical, can reproduce, but the part that the elasticity and part of that surfactant part doesn't. So therefore, sometimes the tissue might be suitable, but the surface area around the alveoli is not. So you can't reproduce that. So, but there are certain cells that can reproduce after being skin cells, can reproduce after being damaged. So when one is replaced by another. Guys, there we go. So back to stuff we've talked about. Things that we've talked about it a lot throughout our days together. Homeostasis. So disruptions of homeostasis, right? So now we introduce the fact that homeostasis can be disrupted by acid-base balance, right? We know that because if we become acidic, the body starts trying to compensate to bring back a level of homeostasis. So it gets disrupted that way. And we talked about electrolytes when we talked about potassium, sodium, calcium, right? And how when the cell becomes acidic, how they get kicked out. Well, that's an electrolyte imbalance. And we know that it's not a good day when those three electrolytes get kicked out into the extracellular fluid. That causes a disruption of homeostasis. But the degree of effect of the homeostasis being disrupted can also matter by size, age, and underlying medical condition. So give you an example. Let's say when we're talking about homeostasis, let's say you have, we'll use a patient who has a history of congestive heart failure. Okay. And so let's say that 2 years ago, they were not compliant with their high blood pressure medication, and it comes back one day to haunt them. Right? They've been having some of that fetal edema. They've had this wet cough. So we know that that left ventricle is very large now. We're having a hard time providing the oxygenation that we need. We know about congestive heart failure, left side heart failure. And so we come out, we do our thing, man. 2 years ago, we come out, we treated the patient appropriately. We provided O2 non-rebreather. We, in the AEMT states, we'll start a line. ALS will come out. We'll give some nitro. We'll get some Lasix. We'll put them on CPAP. Right? We turn this thing around, and we can turn congestive heart failure around pretty quick. But there was a period of time 2 years ago when that patient was hypoxic for a little while. I mean, they might have been knocking on failure's door, right? But we turned them around. Well, you have to understand the body pays a price for that. You're paying a price for that period of time that you're hypoxic. Let's fast forward 2 years now. That patient says, never again 2 years ago, I'm not going to go without my high blood pressure medicine. Damn it, I'm going to make sure When I get my prescriptions filled, I'm gonna do it. So again, they start reading about those herbal remedies, how good zinc is. Zinc is awesome, and I'm gonna take a garlic tablet. It's official, and damn it, I'm not ever taking this blood pressure medicine again. Well, here we go again. And 911, I can't breathe. We come back out. 2 years later, and now we're dealing with the same problem. But this time, the patient goes into failure. Right? We have to start bagging the patient. You're on the scene, I come out, you've got a line, you've got the patient, you're bagging the patient, oral airway in place, doing treatment, and I'm gonna come out, I'm gonna protect the patient's airway, I'm gonna intubate this patient, we're gonna go to the hospital. And patient gets admitted to ICU, and the problem now is trying to get them off the ventilator. Trying to bring them off the vent. It's going to be a job. And because the body just doesn't do well in congestive heart failure state after you've intubated the patient. They just don't do well. And so the patient dies. But that past medical history hurt that patient because of the period of time that homeostasis was disrupted. And so those are things you have to think about when you're treating a patient. I do. If this is a new onset of congestive heart failure and the patient is otherwise healthy, other than uncontrolled high blood pressure and non-compliant with high blood pressure medicine, probably gonna have a good outcome. And so I'm gonna be moving, right? I'm gonna be doing my thing, but I mean, you know how it is, like you're cleaning the house, right? You get it all cleaned up. And then the next thing you know, somebody calls and says, hey man, I'm 30 minutes away, I'm gonna stop by. And you're like, oh, okay, come on, man. Be glad to see you, dude. Can't wait. Bye. Start really picking up the cleaning, right? So the same thing in what we do, right? First time I'm just kind of moving. I find out this, patient has a long history of this. We were just out 3 months ago for the same thing, blah, blah, blah. I am going ahead and, in my mind, I'm thinking forward, this patient may not do well. We may end up looking at having to be extremely aggressive here. This patient may decompensate quicker than somebody else would, right? So that's how homeostasis plays a role with underlying medical condition. Let's talk about age, right? And so age and size. And so what we can look at there is pediatric patient versus adult. If I have a pediatric patient who is hypotensive in a trauma situation, right? Am I going to have to worry about the amount of blood loss as opposed to the amount of blood loss from somebody who's an adult who's 4 times bigger? That pediatric patient, it's going to take a lot less, right? So let's say you come out to my house, I call 911, nausea, vomiting, diarrhea, and I've been sick for 2 days, and I'm a little bit dehydrated. You're gonna go, okay, pop a line in the fluid, make him feel better, good day, right? Your next call is a pediatric patient that's been sick for 2 days. It's had 3 or 4 episodes of vomiting and a couple episodes of diarrhea. Kid's 3 years old, weighs about 55 pounds. That's a critically sick kid. That kid's if that kid is vomited 3 or 4 times and diarrhea, hasn't been able to intake fluid for a day or 2, that is a sick kid, guaranteed. That's an emergency response back to Eggleston, right? And so that's your difference. I've got more volume to mess around with. The container is larger, right? 2-liter Coke versus a 20-ounce Coke, right? Same thing here. So that's what we're talking about when we talk about homeostasis, and that's the common sense part of it too, in a way. That's the easy part to kind of understand. I mean, I can see that. I can understand that. So edema, your book makes this so hard, but it's not as hard as what your book wants to make it. Okay, so if you look at when we're talking about some of these causes of edema. All right, so let me just look here. It says arterial dilation, and you're thinking, well, what the hell? Allergic reaction. Okay, what happens when you're dealing with somebody who's having an anaphylactic reaction? Yeah, vessel dilation. All right, where does my body fluid go? Down, right? And so I might see that with some peripheral edema. Right? That's not too bad. All right, and so then it starts talking about your next thing on here, venous obstruction. Okay, and so we can think about venous obstruction because when you think about arteries, I want you to think left-sided heart. When you think about veins, I want you to think right-sided heart, because oxidative blood comes out, all right, from the aorta, large artery, goes into arterioles. Now we're going to go to the capillaries. All right, we know the capillaries are generally small, right? And so that's where your gas exchange occurs, right? With me? Is that where CO2 and O2 changes? All right, cool. Now we're going to go back to the right side of the heart because we got to pick up that oxygen again. So what's your smallest vein called? Oh, okay. Past capillaries. Because capillaries are venules. Then we're going to go to veins, right? And then those veins get kind of large because we got the inferior and superior vena cava. Drops it into the right atrium. Right? All right, so when we're talking about something then that is going to include venous obstruction, well, how about right-sided heart failure? That's a backup. That's going to cause edema. Okay, so that's one example then of how we can see edema, right? Right-sided heart failure. We can also, because your book says hepatic obstruction, hepatic. I couldn't even say it. Hepatic obstruction. And so when you think of that, you go, oh my God. But it's not that hard if you think about it. Aorta comes down, and we kind of, the way we draw it looks like a box. But really, the aorta comes down and starts splitting off. It's got to feed all these organs. And so your aorta comes down, takes that blood into the liver. Well, the blood from the liver has to come back to the right side of the heart. And so it comes out through the hepatic vessel or hepatic vein. And a lot of times, sometimes those will get occluded with a clot. And so if that happens, it starts swelling and increases that something called hydrostatic pressure. That increases. And we know what happens when hydrostatic pressure increases. Something's going to be pushed out of the vessel. Can you push out white blood cells? Can you push out red blood cells?
Plasma.
Can you push out? Thank you. Can you push out? Yeah. Platelets? No. But if plasma is mostly water, it's going out. Right? So it's going to go out. There's your water coming out, and there's your edema. And edema is going to go down most of the time. It's going with gravity. And it's going to be right there in your feet. So let's say, for instance, I am having one of these events where I have congestive heart failure. I have a blood pressure of 190 over 110. right? I got a wet call. And you look at my feet, maybe I don't have fetal edema. And you guys say, okay, well, let's start an IV. Start an IV, okay? And you're gonna say, well, we don't want to give this person a bunch of fluid, dude. They already have a problem with fluid. Do we want to add more fluid to that? But maybe we just want an IV push drugs. Right? ALS is coming. We're going to give some drugs IV to help this patient. So we need a line. And, you know, so you say, well, I'm just going to put an IV in sodium chloride. I'm going to keep it barely going in. Just enough to keep the veins open. Cool. You do that, but you accidentally open it up. Something you were thinking, you went to make sure it was a good IV. You want to see it dripping really fast for a second, and you open it up, and somebody distracts you. You go, oh, okay, what's up? Yeah, I'm doing good, whatever. Next thing you know, you look over there, 700 milliliters of fluid's been in. You're like, oh crap. You look down, feet are like huge. Patient really can't breathe now at all. So what can increase, what can cause edema? Well, we can, right? We can cause that edema. So an increased vascular volume. If we increase that volume, it can cause edema. What if I have too much sodium? I'm retaining sodium.
Retain water.
Water follows sodium, right? So that's gonna bring out water inside that intracellular compartment, where a lot of water already is stored in the body. It's gonna draw it out, where it's gonna go to your feet. All right. So well, I think we're almost done covering some reasons here. We all know that pregnancy can cause edema. We talked about that. And so there's your reasons why you can have it. Go ahead.
Very overweight is lymphedema.
Well, some of their overweightness might be secondary to lymphedema. Because if you look at the lymphatic vessels, right, what they're supposed to do is, you know, extract fluid, right, and fight infection, but they have to return that fluid back to the vessels, back to the veins and so on. Well, sometimes folks who have lymphedema they start swelling because of fluid retention, and it looks like that they're 500 pounds when really it's the disease process that's caused it. Yeah. So a lot of times it's not because they got lymphedema from overeating. They're just big because of it. All right. So now we get to talk about this subject. We get to talk about isotonic fluid deficit. And it's important. The reason why you got to know this is the fluids we're giving, sodium chloride is isotonic. Okay, so it matches the percent of sodium that's inside the cell. And the reason why that's important is because we don't want to give something that's going to draw fluid out of the cell. And we don't want to give something that's going to cause fluid to go into the cell. We want to hydrate the cell, right? That's what we want to do. We want to hydrate that vascular space. And so we're going to talk about this. If you look at the definition, it's a decrease in extracellular fluid, right? It's the deficit, I'm sorry, isotonic fluid deficit is a decrease in the extracellular fluid when you compare sodium and water. Okay, so once you compare sodium and water. Yes. Yeah, absolutely. This is the most common form of fluid loss. And it's, the reason why that is because, you know, isotonic fluid matches that of the inside of the cell, outside of the cell. So if I'm sick, if I have nausea, vomiting, right? Well, that's isotonic. That's what I am vomiting. And so what happens is that when we start looking, and we'll get into it in a few minutes, but the cell then will need to draw from extracellular fluid, right? And then we'll replace its fluid with that. And so what that means is if I'm nausea vomiting, that cell needs to be hydrated. It's going to take from that extracellular fluid, and the body's going to try to, remember, homeostasis, to balance out both sides of that. And so we come along and we provide the IV, and then we give that vascular space, that extracellular fluid back. The body then can readjust, be really happy that you did that, because now it's no longer dehydrated. But isotonic fluid. So how does that happen? And I kind of gave one example of how you can have isotonic fluid deficit by vomiting. What's another way? Diarrhea. Okay, take that. Good. What's another way? Sweating. Right. A person who has suffering from heat exhaustion can have isotonic fluid deficit. All right, so that's just kind of easy to figure out. How can you have excess? Yeah, well, how can we have too much extracellular fluid? Bam. Well, not so much sodium in that case, because how can I have too much fluid? Water. I can have too much water, not just sodium, but water, right? And that was getting the kidneys back up. The kidney failure, renal failure, right? If I can't get rid of waste, then it's going to back up, and I can have the fluid excess. Go ahead, P-Raz.
So excess, like, we'll give a good example of like what would eventually cause like kidney stone like this.
Sometimes what happens is your kidneys takes a beating from having high blood pressure, and there's a certain hormone called creatinine. Creatinine is formed, and that causes that kidney tissue to start dying, right? And so when the kidney tissue starts dying, the organ itself starts dying. And then you look at what the function of the kidney is. Well, it's to excrete waste. It can't do its job anymore. So it starts backing up. That's one. Is there another one you can think of? There's one more. What? Heart failure? Yeah. I mean, no, it's something that the body doesn't do. Well, you can drink too much water. Okay. What about something though that the body has no control of? Steroids. What if it's something that we do?
ADH.
Something that we do. Something that we could do. We could cause this.
Excessive sodium intake.
You can have it, right, you can have that, that would cause an issue. I'm looking for something, well, we kind of do that, if we gave the sodium pills and said, here, take them. If we start an IV and let it roll,
I thought you were talking about the, I see.
Yeah. if we start an IV and we say, you know what, I'm gonna give this guy 4,000 milliliters of sodium chloride. Yeah. Man, we could do that. So yeah, we could actually cause this. We could cause the fluid excess if we don't treat the patient appropriately.
Each bag is about.
Yep, each bag is 1,000 milliliters. How are we on time, sir?
5 minutes.
5 minutes. Okay, so I want to take this. We're going to stop here for a second. I want to take 5 minutes. 5 minutes to talk about study habits real quick. I think we need to think about study habits again, only because for this chapter and the next, this chapter and the chapter was kind of difficult. Sometimes they're difficult to understand, and you're going to have to add something to this. You can't just come to class and depend on me to provide you with all the answers. You have to get some ideas about what these answers are so that when I'm here, I can be more effective to you. And so I got to thinking about, well, how could I explain this to reach out to touch you? And so I started thinking about learning habits, and I started thinking about why students are successful, right? Why are students successful? And so there's different types, right? And we know this. I mean, we've got those students who never open a book, never read anything, they just get it, right? But then we have the other one, and I have a perfect example in our class of this person. I have watched them, and I'm observant to how they work. And I'm going to use you, Bloom, for a second. For a second. So here's an example. I really truly feel this about it. That I think he works 4 times harder. And you correct me if I'm wrong. But you really work hard to make sure that you understand the material. How many practice tests did you take before you went to take registry? How many did you complete?
Every single one that I could get my hands on. I mean, I couldn't tell you
That
how
was
many of them.
more than 50?
Yeah.
Yeah, more than 50. All right. The other day, you asked me a question about the study guide. When he presented the study guide, he had already typed it out, and I looked and I saw like several of the answers to my questions. Here's somebody who works extremely hard to make sure that they understand the material. So if you're not that type of person who just gets it, then you're in with everybody else in the average size. Even though Bloom here is an above average student, he works hard to be above average student. He is doing a lot of work to make sure that he gets it. You have to find that place where you can find that concentration level, whatever it is, it takes you to that place in your life where you need to do that work, or to examine yourself to work this out in your schedule. They call it study habits. Habits are something that you do every single day to the point to where you don't think about it anymore. It doesn't mean that, just like getting up and being on time for work. Y'all get up every morning to do the same thing. You may do things different. Some people may run around their house 8 times and do 10 other things that you don't do, but everybody shows up on time, right? For the most part, I don't have a problem. Most of you guys get to work on time. So, irregardless of what you do prior to that, like in the mornings, I get up. I usually, tell my wife what fit she is because I get to going. Just kidding. I love my wife. My wife. No, but seriously, I get up. I go. Yeah, I get up, go, oh, I'm thankful I have another day. And so she's not watching. She's not watching. And so because she would have to sit and watch her husband. Right. We're probably at that point in our marriage where she gets nauseous looking at me. I don't know. But no, seriously. So I get up. I brush my teeth. I take a shower. I go. I've already got my shirt, my pants. I got all my stuff right here on the counter. I got my wallet, my keys. Right. I've got my, everything's there. I do the same thing every morning. I get up. I get that done. I go downstairs. I make some coffee. But sometimes I let the dog out, depending on, if she wants out or not. Yeah, her mood really. She goes down there. I go, let's go. And then head out. Now other people do things different than that, right? But we all show them. So my point is, you might have to add some steps into your day to get to where you're successful, right? So think about that kind of stuff because, these chapters are difficult. I get it. All right. So thank you for your time. Go take 15 minutes. Take a little 15-minute break.
Instructor.
15-minute break, Mace.
Uh,
Go ahead. Go ahead.
So when you were talking about water retention, fluid
Yep.
retention, and whatnot, can ADH play a role in that?
Yeah, you know what? Your book talks about that, but it is, well, of course, ADH does. It's anti-diuretic hormones. But your book uses, what example did it use? It used
No, you didn't. I'm sorry. You typed out
your
the answers.
ACTH hormone, right?
Mhm.
ACTH is the thing that makes cortisol.
You said
All right, so it actually lines up to make cortisol, which plays a role in fight or flight and all that. And so I don't think that's a really good example that your book uses. But your anti-diuretic hormone can play a role, obviously, in ADH and fluid retention, sodium retention, stuff like that.
Yeah, or that ADH, where if we need to retain that fluid, the body's going to release it. Could that be used? Could the body release it prematurely, and that cause that problem?
I suppose it's possible, and it's like Cushing syndrome or something like that, a head injury,
Okay.
Nervous system injury, something like that. But so yeah, I guess that is possible, but it's not a common deal. You know what I mean? It's not a common reason for edema.
Gotcha. Thank you.
You're welcome. Gwen, how are you today? I haven't talked to you.
I'm good, thank you.
Hicks, you okay?
Oh, yeah, I'm pretty good. I just been up, just trying to study a little bit more.
You said you've been doing what?
I just been up trying to study a little bit more. Get up about 6 o'clock and kind of review the study guide some more.
Okay.
Mhm.
'Cause I'm coming back tomorrow. Damn it!
Oh, are you really?
I'm gonna just lie and say I have those. I mean, I don't really have symptoms. I know it's my sinuses. And I'm thinking, she asked me, do I feel like I have COVID? I said, I don't feel like it. I just feel like, sinus pressure. I take over the counter stuff for that, it goes away. She's like, well, we're just gonna keep you at home. I'm like, come on, man.
Yeah, well, they're going to play it safe, and that's a good thing to do. We want to put your safety first.
Yeah, man. Me being home and my wife finding me stuff to do.
Yeah.
Another example.
Dr. Morris,
It could be, yeah, because blood loss is part of plasma loss. Go ahead.
the test tomorrow is just chapter 7 strictly, right?
It is, yes, sir.
Okay, okay. And he said the only thing, I mean, I know I get the study guide, but the only thing we need to know about the cell is pretty much just the mitochondria and the nucleus, right?
Yeah, I would, that's it. That is it. We're gonna do a review today. Right? So we're gonna do a review today. But yeah, you're right. That's all you need to worry about.
Okay, okay. I just want to double check.
Instructor Morris,
Yes, Miss Gwen?
if we're not back tomorrow, would we just be taking the test online?
You, yes, ma'am, you will. That's the
Okay.
plan. It'll be the same test. You just take it online.
Okay.
Have you come up with the amount of questions yet?
Yeah, it's like 71, I think.
Yeah, he fell. You know how many tests we're gonna have?
Not yet. Mhm. It's not about the quantity, it's the quality, right?
Is the next test on just chapter 8?
Yep.
Hey, great.
I'm over this Zoom thing too. God. Oh, hang on a second. Let me see if I do this. Hey, can you guys see that? The timer? I was talking about for Zoom people.
Oh, yeah, yeah.
Mace, can you see a timer?
I can't.
Okay, you can't go in.
No, sir.
Try to put the timer in there.
Negative.
All right, well, I'll come back, let y'all know. Y'all got about 13 minutes left.
Sweet.
Hey,
That was not close at all. On my little Nas X
both just smile and barely step away from each other.
You still doing the welcome house? You not doing that no more? So, why? You still go there and just get your get you a cup of coffee. Yeah, just
Big belly
So you just go there and get a for no, sausage, hash browns. Man, don't listen to your 3 months. He eats the same thing. He has no taste buds, so he doesn't know the texture of different foods, flavor.
Oh.
Right, you eat taste buds? I can count on one hand how many times that you have eaten something different. And man, start every day was
3 months of salt and pepper.
I got
Regardless, that's then 3 months.
So when we at that end in November, that's when we end the classroom, or that's when we end the. I think that's when we do the course. So that includes the. Still live. 5 months.
Is it 4 or 5?
4 or 5. March. Woo, that's too far, bro. April. I gotta get my running. What's that?
That last month though.
Come on with me.
Here.
Come on with me. I'll run with y'all, bro. I'm with that. We probably graduate. No, we get together. May. You live in Low Bar? Low Bar? May? Oh, it's over. Where you live at? Come on, bro.
How far are you from-
I'm already on Old National.
How far are you from, Alexander Park? How far are you from the Walmart on 124? So if you're going, so if you pass the Walmart on your right, so we go towards, there's like Web Gym right there, there's Chili's and stuff.
Oh, wow, what?
I used to work at that Chili's right there when I was a kid. And so if
You
you
look
turn,
like you work this shit.
so if you turn right, actually, if you keep on
You're
further
like you're the
down,
only one that they call
it's on the
on.
lights on the left, there's a big park, it's like out of the park. And add that light down, way down there, that's. Picture goes to the right, I'm down.
So you might discover. Also, you.
No, just go left on Sugar.
Oh, okay.
Yeah.
And the funny thing, I'd be a fish.
You know exactly.
You say.
Right there.
What? My best friend's sister lives over there about like 7 years. Mom.
It's funny that people still call it Discover Mills. Sugar Loaf Mills. They actually just opened up a pop-up.
They got a jump. I used to go there with summer camp. I worked there. My church, we went up there to the Jump Street. They got trampolines, got
Yeah, actually, when I was young, when Discover Mills first opened up, that was a big skate park.
What was the skate park? We used to go to the Medieval Times. We just went to the Medieval Times. I want to go get drunk.
You can get drunk there.
Don't go there drunk. It's mostly kids. This is mostly kids. You know what do like on the that's what you can take out. Just a lot, baby. I mean,
You don't even need to do that, it's a syringe. No, you stab it through the hole where the straw goes.
or you can do it like tipsy bartender and have it to where you slice like a little bit of the paper off, like a Listerine bottle. Or get full of vodka and put like some 2 quarts down. We're on a cruise. On a cruise. I said, I'm a dog. I've never seen nobody just do that. Even hit iceberg. Iceberg leg. Great, it tastes good. Oh, that's disgusting. No ranch. Like, damn, put some ranch on it. You know, that's lettuce or cabbage.
Cabbage. Oh, okay. I can.
That's even worse. That's even worse. You can eat lettuce. Cabbage, you can sit there.
That's what's weird. People like learn grades. I don't know. They think that like you just need to like eat stuff. You come to like this.
I just eat the outside of this orange.
Pile of sliced deli meat.
Mountain man, every time he did it. Oh, it on the ground.
Every time he does that,
Yeah, so it's like,
I had to try to get jelly meat. Wow, I'm already balanced. I like it, boy. The whole time I get like jelly meat, is like when I go to book. You know, it's a fun one, right?
So I got it. Hey, just the video of the dude dressed up like a maintenance worker at the Kanye thing.
Yeah.
He dressed up like a maintenance worker straight in, and he's like,
I saw that he was like a photographer. He saw one.
oh yeah, he dressed up as a photographer. And he literally walks through security and everything. He's on the field. Intern actually has got more seats than him. He's like, I got a better seat than him. So they're like, he's literally on the fucking floor.
So where's she? No, Jim K held him down.
See that video of the Chinese
You gotta eat. You gotta.
Thanks.
I ain't gonna lie, I would like to be
Hey, look. Guys
I love buddies. Family and whatever they want.
Here's what's crazy. See that?
Hey, man.
That's my 12. 211.
Yeah, if I don't know you, depending on how many songs.
It's on me,
What about for me? What about for me? You get money for one song. You might as well go ahead and
This looks
step in the name of God. I'm most
not so
for
yeah. And then these three were no, but these two are different years.
Yep. Where you going? My people that I know, like,
How's your 15-year-old boyfriend? He's
Why is she still dating him?
Yeah. No, because she's getting fucking hyped. That's why. Are you talking about your little poor sister? He gets mad at us. It's just it's not our fault.
Get my fucking butt. Do something about it. Maze, you're gay.
He can get mad at me.
What did he get out? What did they get out? What did they get out? No, what did he steal?
That's good. It's like this is
What did he steal? What did he steal?
I mean, what kind of weird beef? That's more concerning than if you would have stolen. I mean, it's a baseball. Also happened on your watch. That's up. I'm like, what's up? I don't understand. Why don't you beat this kid's ass? He's fucking, he's stealing your pants and shit. Like, it's never you on his ass.
We left at 9:30.
Hey, why don't you go? JJ,
Yeah, I got it. Don't worry, guys.
Yeah, I'm surprised you heard him stealing it with the full ass ears.
Hey, why don't you shut the fuck up, man? He didn't steal anything from me.
I mean, he's fighting your sister and stealing from your family. It's time to whoop his ass, brother.
You shut the fuck up.
You're going to bitch slap a 16-year-old boy.
It was just my water bottle.
What's he look like?
It looks like me.
That's weird.
You're going to have to pay for a bitch slap.
Yeah.
I would have already whooped this kid's ass.
You got the mom here.
Tell me he's got a picture of himself at the gym, but doesn't go on a regular basis.
I don't know. No
I bet he does.
he thinks he's a god at baseball too.
Not good at all.
I'm gonna show my dad.
Yeah, you should. Tell him.
What position?
Yeah, let me get some words. Let me get some words in for your thoughts on this live.
This Johansson's got to get a hold of that. Oh, well,
He gets angry. He doesn't show it.
That's so sad. He stole from his family.
He shouldn't have to do anything. This kid's 16. You should have already whooped his ass. Next time he walks in the house, you grab him by his neck. Next time he pulls up.
He can barely drive.
Well, barely enough. He can barely drive, but he's all the way to his ass.
How old is he? Oh, you can't. You ain't gonna have evidence where you are. It's your ass beat. That's gonna be him. That's not hard. I can't touch him yet. It's not hard. Your dad can touch him.
Hey,
I do have some friends.
it's that video I saved in the night in the group that went up. It's time to go see your sister needs to get pregnant and needs to get the ass. You know what I mean?
Get his mom pregnant,
son.
Shut up, man.
Yeah, apparently his mom's pregnant and walking out. That can actually work out.
So that's where I learned to steal.
That's the opposite of the thoracic, right?
You probably still cop through like rail guard majority of
Bones.
They're all a piece of shit. That's mom's pregnant. They let him do it.
You know what I don't understand about
Maze. Oh, you're right there. Hey, Maze. You're gay.
We're live on YouTube.
I know. I don't care. What are they gonna do? Fire me?
Maybe.
What's wrong? Bunch of firework line.
I thought he wanted like that reflection.
What is it?
I was gonna steal you off camera.
Maze is the fag. You don't like to say it on this speech. There it is.
Hey, did you make out, take them away, buddy? Did you make out with your guinea pigs today?
You do what?
Did you make out with your guinea pigs today?
No. I'm gonna beat you when I get back to class next week.
Yeah, you're not coming back, buddy. Hey, let's get your guinea pigs out, dude.
Oh my God, why?
What do you mean, why? We gotta see him, our class mascot. We gotta see him every day. Yeah, we gotta see you coddle him on your shoulder every one. I wanna see both of them. I wanna see one on each shoulder.
Oh my gosh.
Myocardial contractility. Maybe they'll kill each other. Are they at your feet right now?
No.
Yes, they are. Little shit. Bye, man. Man, I really. Dude, Maze, are you gonna cheat on your test tomorrow since you're gonna take it from home?
Oh yeah, facts.
Hey, I'm showing that to Boris.
What's that?
Cheating little ass. I'm showing that to Boris.
You bother to shave?
Who?
Ew.
I did. I shaved this morning.
I can see like a nice shadow down the sides here.
It's called being a man, babe. When you grow up,
Especially Cooper there.
you grow hair after you shave. So it's called being a man. Look at his face. His face does the same thing. Cooper's face does the same thing. You're just a baby.
I know I am.
When are you coming back?
I don't know. Cap said he's extending my time until probably next week.
You're gay.
So what are you doing for the test then? Do you take it online?
I think so, yeah. I told her that I was using medication for my pharyngitis. Or like, yeah.
Hey, what's your address, bro? I'm gonna come get COVID real quick so I can take my test online. You're getting roasted over here, man. I want you to know that. I wish I saw this one too.
Oh, this is nothing. This is nothing.
Hey, kill that bug behind you.
What?
Kill that bug behind you.
Where's Westcott?
Yeah, that was my old department.
Yeah, Colorado. Put Boulder Crest up. Yeah, put Boulder Crest up. We'd rather see that than your daily fire. Dude, I want to see the Hummer from yesterday. No, it's gay. Don't look at it. I want to see your apartment. Yeah, there it is.
This thing was an awesome rig. JJ, you can go.
That's a waste of money.
It was the sweetest thing to use in a snowstorm.
The Humvee. That's a Colorado fire department. Should probably got donuts.
This thing was diesel and she could plow, let me tell you.
I wanted to be. Why don't you just go back to Colorado?
Go. Just go. Just turn your screen off.
Hey, should I put the big lady on?
Yeah.
The big
Hey, will you? Oh God, that's even worse. I actually put a big lady on there. What's it called? Yeah, I'm going there. That's JJ's favorite car, isn't it?
Yeah. He doesn't understand. He'll learn. He's new to the fire service.
What? Hey, you've never been in a real fire.
Hey,
Go ahead. Not all of us have to put with the rescue.
hey.
I love watching you.
Hey, Mary's.
Gonna be riding on the bus.
Are you ready, Mace?
Yeah.
About to start again. Maze needs a letter.
Mace, need a letter.
Yes, sir. Copy that.
I wish that would.
You see the social media.
I got mine. I did all my.
Starting over.
Well, I wanted to share it. It didn't do right.
The photo is so intense. They're trying to make it seem like they're being so rushed. There are questions at the end of this slide, like the last one.
I don't know.
Oh, no, it's some tree probably been through the whole book already. Why don't you tell us?
Hey, Maze, what are you looking at right now?
I'm looking at chapter 8, pathophysiology.
Okay. Is it, you just looking at one slide or are you looking at the slides? Are they on the left as well? Or is it just one slide?
It's just one slide and it's like the front cover of the book.
Cool. All right.
Yeah.
All right. So let's talk about sodium. So what do we know about sodium? Where does it live?
Outside the cell.
All right, outside the cell. All right. And so let's talk a little more about what its function is, okay? Let's say that sodium controls the movement of water across the cell membrane. So its function is to control the movement of water across the cell membrane. It's also responsible for muscle contraction and nerve impulses. Here, let me swap us over here 1 second. Maze, are y'all looking at the whiteboard right now?
Yeah.
Okay.
Yes, sir.
All right, good. Okay, so that's what sodium is responsible for. I want to talk a little bit about so muscle contraction. Let me add this too. Nerve impulse transmission.
What'd you do there?
I can't, like,
What is that?
trying to draw on this. Good, all right, so here's our cell. And what I want to talk about is when we talk about hypernatremia. So what is that? What is hypernatremia?
Over 142.
All right, so hyper elevated, right? Natremia, so they call it sodium. All right, so here's our sodium, and so all right, so here we have our sodium, and so let's look at the definition here. It says it calls it a hypertonic state. All right, and so what then if I have this too much sodium and we're calling it a hypertonic state, what does that do to the cell? That's right. Also remember how we find it. So how do we know? Somebody has too much sodium. Well, we do a blood test, right? So we take some blood. It's called CMP, chemistry. All right, so it's going to tell me about sodium, potassium, calcium, some other stuff, right? But in order to be able to draw the blood, we're not seeing what's inside the cell. We're only able to see what's outside the cell. And so we know then if we have sodium outside the cell, then it was forced outside. It came outside the cell, which we know it lives there anyway. But what we know then is that if we don't have enough sodium in the cell, then we're going to draw the water. The intracellular fluid is going to come out, and it's going to make this cell shrink. It's going to shrivel. So how do you fix it? Yeah, just got to figure out a way to get sodium back in, right? And so that's how you fix it. Because once we force sodium back in, then hey, good day. But so let's think of some reasons that would cause this. And so remember, there has to be a balance. We'd have to have a balance. So if we're talking about 3 outside, we need 3 inside. And so that's the body's way of balancing it. But what if we have a loss of sodium outside in that extracellular fluid anyway? What would cause a loss of fluid from extracellular fluid? Yes. And why is that? Because that's where, that's where our fluids, that's where it comes from. If we vomit, extracellular fluid. If we get shot, we're losing plasma, extracellular fluid, right? So all of that's extracellular fluid. Like when you stick somebody's vein, you get a tube full of blood, extracellular fluid. That's what we're seeing. It's mixed in. That makes sense?
Sure.
All right, good. So that's how, if you're vomiting, I know you're not losing blood, but you're losing water. And what's water made up of? What water is mostly? Blood or plasma, right? So even though, what's that? Yeah, plasma is mostly water, but it's a component of blood. So if I'm vomiting, I'm not vomiting blood, but I'm losing a major component of plasma. That makes sense. All right, so if I get shot or have a car accident, I have closed abdominal trauma, and I'm bleeding, I'm losing extracellular fluid. And so that's how you look at it. All right, and so the only way then to fix this is a couple of things. If we're vomiting or heat exhaustion or diaphoresis, and we need to replace the sodium, besides you've covered your primary survey, done, check. Secondary survey, done, check. Got your vitals. We need to come up now with a solution to how we're going to fix it. So we give them a little O2 maybe. We're going to keep them warm. So what else could we give? Sodium chloride, IV sodium chloride, right? Because if we look at it, it's 0.09% sodium chloride. And so that will actually start replacing the sodium that's lost. And even though we see that we have a lot of sodium in the extracellular fluid, it's the intracellular fluid that's giving it up. It'll start reabsorbing what's lost. And everybody can kind of go back to normal. As far as what we carry in a pre-hospital setting, yes. All right, so the opposite of hypernatremia is what? Hyponatremia. All right, so here is that. So instead of having sodium on the outside of the cell is suffering what type of state? Yep, a hypotonic state. So meaning what is happening then, we don't have a lot of sodium in the extracellular fluid because it's all in here. And so water always follows sodium. And so we're going to have it following. So it's going to come into the cell. What is that going to cause that cell to do? All right, it's going to cause it to get bigger, isn't it? It's going to start getting larger. And it's like a balloon. Eventually, it can rupture, right? And what is that called?
Lysis.
Good.
It's called lysis. It's just so small. Pretty much.
That's when the cell has so much fluid in it that it bursts. Right? And so that could cause lysis. All right, so everybody understand how that works? All right, good. All right. Let's talk about some causes then of this. So we've talked about a couple, but we can repeat them. What would cause either hyponatremia or hypernatremia?
Sweating.
Thank you. Sweating.
That's hyper.
Hey, come on, HEA. Thanks a lot. You know, all right, sweating, diarrhea. What else?
Excess sweat.
Vomiting. All are some causes. Well, dehydration is not, that's a term. I'm looking for symptoms that would cause this. So, all right, so those are good for hypo, right? What is something that, again, what is something that we can do to cause the sodium?
Oh, that was high. Yeah, appropriate IV or diuretic.
Hypo makes the cell swell. Hyper makes it shrink. Let me make sure I'm right. Because I'll be wrong.
No, that's
rid of water.
yeah, because with the hyper,
So hypernatremia is too much water and it's gonna cause the cell to shrink.
it's rushing out of the cell.
Yeah.
And then hypo.
And hypo is going to cause the too much sodium outside the cell. And oh, you know what? I think I did say that wrong.
I was saying that's why we're confused. Is like how would
my bad.
sweating cause the water to rush in? If
I mean, anything with ECF is coming out.
Yeah,
that's
too
gonna be
much.
hyper.
Right, too much sodium pulls water. And when we're talking about, let me look at my notes one more time here. So, that's okay. It's my bad if you're lost. Because I think I misstated it. All right, so a hypertonic fluid deficit occurs, right, when there is water loss in the body without proper loss of sodium. In other words, there's a relative water loss. This condition is hypernatremia. And that what that means is too much sodium is pulled out. And if you pull too much sodium, remember, water follows sodium. Right, water follows sodium. So here's my cell, right? And here's my sodium. And so it's hyper because we know, because we can read it through the blood test from the extracellular fluid. And so it's coming out of the cell, and with it comes water. And so if I take too much water, it's going to cause the cell to shrink, right? So instead of that big cell, we have a much smaller cell, right? And so that is hypernatremia. So write that up here. And all that means is a lot of sodium. Hyper elevated sodium. Yes, into that extracellular. Yeah, let me write that here. Here's intracellular fluid, and this is extracellular fluid. So all you gotta do now. Hang on 1 second. Stay with me. Nope, stay with me just 1 second. And
Clarification, got a second instructor.
no, I don't have a second yet. Hang on, I'm trying to bring it together. Hang on, I'm gonna tell you. Man, this hyper, all right, remember, all right, listen, stay with me. Look at page 235, and you can see the state of the cells, right? And so if we have water following out the cell, it's going to cause that cell to shrink. And that is hypertonic. We have a hypertonic state. Because water follows sodium. Remember, you have intracellular fluid here, lots of sodium out here, more out here than inside. That's going to bring with it intracellular fluid. It's going to drag that water outside, causing that cell to shrink. Y'all with me? Cool. Now let's look at the other one. So here we have the opposite. We have sodium inside the cell, too much. This is intracellular fluid. All right, and then we have not enough outside the cell. And so, like we said, water is going to follow sodium. It's just like a water balloon now. If I add a bunch of water, it's going to cause this to swell out, become larger. And now we have a what type state? Hypotonic state. Right, and so this is called hyponatremia.
What can cause that? How could there be too much salt or sodium in the cell?
So what happens is, think about what would cause sodium retention. Because if we start getting too much sodium in the extracellular fluid, it's going to push inside.
Right.
Because the body wants to have even numbers of charges. Well, say if it has what it really wants, if it's got 3 sodiums here, it's going to want 3 out here. And so if we have a bunch out here, it's going to start equalizing it and pushing it in.
There's too much over time, it's going to keep on forcing itself in.
Absolutely. And so if you can't, sodium, it's part of water. So if we can't get water out,
right,
kidneys,
So
renal failure.
Okay.
So we have renal failure to deal with. If we give too much sodium IV, we over bolus somebody. So you have a trauma patient, the dosage is 20 milliliters per kilogram. You do your math wrong. Instead of 3,000 milliliters, you give 6, right? So you give 6 bags instead of 3. And so now the person has too much sodium and it could cause that state. Also, you could have, as far as the losing it, people take diuretics, right? They take pills to help them pee off extra fluid. And this could be because they have congestive heart failure or high blood pressure. Lots of anti-hypertension medicines are mixed with a water pill, like HCTZ, hydrochlorothiazide. It has a water, like Lasix, it's a drug, mixed in with the medication. So helps control blood pressure. Well, if it's too much for the patient, we're getting rid of too much sodium. So that's what I can think of right now.
Is there any way to distinguish between the two, like as far as seeing it, signs and symptoms wise in the field pre-hospital?
It's hard because not really.
Okay.
Not really. Because both cases cause nausea, headache, can lead to seizures, coma. There's fewer symptoms for hyponatremia than there is for hyper. People usually who become hyponatremic over a period of days tend to have fewer symptoms than people who abnormally develop acutely. So not really. All right, Maze, what was your question?
It was answered.
Okay. All right, so let's go back over to the slides. Can you see the slide program out there?
Yes, sir.
Good. All right, so that kind of covers sodium. Battery in there. Let's look at the next one. Potassium. So potassium. So when we're talking about potassium, where does potassium like to live? Yeah, it does. It's the primary intracellular. It's primary intracellular. And so let's talk about its functions. One is neuromuscular control. All right, it regulates skeletal, smooth, and cardiac muscle. It helps to regulate acid-base balance and facilitating intracellular enzyme reactions. It helps to maintain intracellular osmolarity. And so when we get too low on potassium, low potassium levels, what do we call that? That's correct. Hypokalemia. All right, so that means we have a decreased serum potassium level. All right, so low potassium. Low potassium. And so what we will say is that signs and symptoms of that. So we know just covered the function. So do you think we'll have extra muscle strength or will we have muscle weakness?
Muscle weakness.
Yeah, absolutely. We could have fatigue. We could have muscle cramps. So all of that is associated with hypokalemia. But so let's look at hyperkalemia. So if hypo is low, hyper is going to mean high. So high potassium levels. And so again, our body likes to be within a normal range. So when it's outside that normal range, it starts showing its ass. That's the only way you can really say it. It does start showing out. And so what do we have? So we have it'll start interfering with your book calls it neuromuscular function. It's going to start causing problems with muscle contraction, And one of the largest, most important muscles that we need to contract is the heart, right? It's going to start having, your heart's going to start responding to either low or high potassium that way. Again, it's also a big player. Your book says skeletal, smooth, and what else?
Cardiac.
And cardiac. So you're going to start having issues, not just with cardiac, but with those skeletal muscles, right? You go to pick up something, you have muscle spasm, stuff like that. So potassium is really dangerous when it gets out of whack. Okay. I don't think you need to really be concerned about the actual serum level of 3.5 to 5, but understand what hypokalemia is and understand what happens when these levels get high or low. So here we have calcium. We know, so if hyper thing's going pretty well, right? Hypocalcemia means what? Low. And hyper, high. Yeah. All right, we're starting to kind of get that figured out. So your book talks about calcium being a big player, obviously for bone, right? Teeth. It mentions vitamin D being a good thing for calcium. But we also talk about the calcium being a door opener at those calcium channel gates, right? When we talk about sodium potassium pump, we talked about calcium opens the door so that potassium can come out and sodium can come in. In just a little while, I'm gonna have a presentation, kind of breaks it down a little more for you when it comes to contraction and what happens here with this. Let's see here. So if the way we get calcium mostly is through vitamins and minerals that we consume, right? It goes through the GI tract. Remember how we have the large intestine, because it's going to start absorbing that calcium. Sometimes on the low side, again, calcium still important for not just bone strength, but it plays a role in muscle contraction. A lot of times on the low side, decreased calcium intake, right? So, or absorption, right? So through diet, that could be a problem. Why you would have low calcium levels. Some endocrine disorders. So what gland helps to produce calcium? It's the thyroid. So it produces what? Calcitonin, right? And it's that calcitonin that helps produce calcium. So if you have a thyroid problem, you might be hypokalemia. All right. I'm sorry, hypocalcemia. So yeah, so that could be something there from that. When we're talking about an increase in calcium, what causes that?
Could it still be a thyroid problem?
Yeah, it could be, because you could be producing too much calcitonin, right? So yeah, so we can still have a gland problem here. Some type of endocrine disorder from a gland issue. What about, does anybody know what a neoplasm is? Cancer. So yeah, you could have a cancer causing this. And again, problems with those blood pressure pills that have diuretics in them. So signs and symptoms when it comes to hypercalcemia, a lot of times they're hard to pick up. Patients aren't always so symptomatic with this, but fatigue, weakness, nausea, constipation, frequent urination. What's the medical term for frequent urination? Polyuria. Okay. And so when you're talking about, I don't know if so that's with hypercalcemia. When we talk about hypocalcemia, I don't know if I thought it was interesting. Laryngospasms. Anybody know what laryngospasms are? Yeah, you're right. That's the right place. Right? So you can have these spasms right there at the part of the larynx, subglottic opening area. And sometimes you'll have these spasms if you get choked on something. Because what they'll do is it'll cause a lot of times your vocal cords to spasm, and the smooth muscle in your larynx can start spasming, and you can breathe, but it's almost like you got stridor for about 20 seconds. You know, it sounds terrible, but you can breathe, but it's hard to breathe. I mean, you're like, I mean, if you don't know, like I've seen them before, and it actually happened to me one time. And so I knew right away what it was. And so it sounded terrible. I was like, I'm not joking. Yeah, and I knew it was going to go away. I just had to stay calm. It was going to go away. But if I didn't know what it was, it would have been scary. It would have been super scary because it took a second for it to stop. So yeah, laryngospasms. I thought it was interesting. I don't know if I've ever heard that when it refers to being hypocalcemia. All right. We need to talk about phosphate. And I'm not too big on phosphate. I mean, it's important. Don't get me wrong. I guess I just don't. When I'm thinking of sodium potassium pump, and I'm thinking of that being acidotic in the cell. I'm thinking of these as being the main players, honestly. But phosphate is important. It's a primary intracellular anion. So this is a negative charged instead of being positively charged like the other players. And when we have hypophosphatemia, I don't even know if I said that right. We have a decreased supply, obviously, or absorption of this phosphate, and it could be through diet, like starvation, or a problem with absorbing phosphate into the blood. Again, diuretics can be a problem with this. Alcoholism also. Yeah, all y'all probably deficient. I'm going to check y'all right now. So a lot of this is coming from your diet, and some signs and symptoms here, though. Again, it can include heart dysrhythmias, low blood pressure, muscle weakness, altered mental status. It can lead to seizures. Okay, so to fix it, we got to replenish it. And so we would require IV phosphate replacement. So on the other side, if it's having too much, it's called hyperphosphatemia. Woo. All right, and so what we're looking there is excessive use of vitamin D. Hey, I can see some folks going crazy with vitamin D. Like some people in my family, they're vitamin crazy. So yeah, I could see them doing that. Laxatives. all right, or something like an enema. And so patients who take a lots of pain medication, chronic back pain, stuff like that, opioids tend to make you constipated. So they're probably taking a stool softener or a laxative. So they could be in this case of having low phosphate. I'm sorry, of having high phosphate. Chemotherapy, and then metabolic acidosis. Metabolic. The next one, we'll talk about those magnesium. And this one is, I guess I use it a little more because I know that magnesium plays an important role for the body to manage potassium. And so a lot of times if a patient has hypomagnesium, then they will be very low on potassium as well. So it says the second most abundant intracellular cation after potassium is magnesium. So 50% of this stuff is stored in the bone. 1% is in the extracellular fluid. Milli equivalent per liter. MEQL.
Milliliters equivalent to
And it's square, it's yeah, so but don't worry about it. You're not gonna test you on that. So diminished mag levels can come from, again, it's another absorption or intake through diet. Increased renal loss of magnesium, and that again can be related to diuretics. And then other miscellaneous causes like diabetes and respiratory alkalosis, along with pregnancy. Symptoms would include weakness, muscle cramps. These patients may have marked neuromuscular and central nervous system hyperirritability. They could have tremors and jerking. All right. So that's what we're going to talk about. I mean, those are your big players. I honestly, as far as I'm concerned, big player. This I probably should learn more about phosphate. It's probably a big player number 2. Calcium player, potassium big player, sodium big player. We'll go into some more of this through a little presentation that I'll do. Maybe we'll take a break. How close are we? Break time?
4 minutes.
4 minutes. So good. Let's take our 15. What time is it? All right, good. We're good. Let's take our 15-minute break, come back around 11, and we will look at that, okay?
Oh, that's a simple truth brand too, man. That's a good shit.
I'm back about this.
Can I try one?
Oh, yeah. The K one?
Well, boom, can you send me what you got?
You? Yeah. Oh, okay.
That'd be the new.
I'll talk to my wife about this.
I want to do that.
I said, if I go paramedic.
It's not a bad idea.
if you
My
go
cousin's already
paramedic-
PA, his life is like this. I'm stressed
go
out.
paramedic, you might as well go
Yeah,
PA.
we stressed about half of it.
You get $100,000 a year.
He goes into work at like 7, he's home by 2, doesn't go in on Fridays.
It's like.
How long has he been, like in his practice?
2 years.
Okay.
Well, you got
So he's
$200,000.
still pretty early.
What's your degree in?
Criminology.
Criminology?
Yeah.
You gonna be a detective?
They take it. As long as you have 3 requisites.
You gotta have, I think for Emory, you gotta have like 30 semester hours of.
Hey, you started it. Shit.
You
I'm
go do
about to-
that.
I'm about to put on some
It's
clothes.
usually biology,
Put a bubble bath on.
Anatomy.
anatomy,
Chemistry, and physics.
yeah.
I don't got
And
physics.
some
I got
people,
everything
yeah, some
else.
people take chemistry more than others. They sometimes
I
have
took
that.
chemistry. I didn't take physics. I had everything else but physics.
You could go to PA school. You're like the perfect candidate.
Yeah, because you got to, I like that.
Organic chemistry,
And they want,
genetics, biochemistry.
You took all that?
I bet you're very-
I know, right? That's me just so quiet about it.
Yeah.
Like,
When you don't want to help nobody.
I'm telling you, Brett, this is like a regret. Most of the time when I was taking in house, I was just. I understand, I promise you, I was taking 4 years.
I tried to look up your name in the phone book. I couldn't find your name. I need some questions. I would have to pay for it.
that is still got the phone book.
That's all I had. What you got, okay, so-
Oh, I need a mechanic.
No.
I got a couple of them on phone.
You like porn on the internet. You still got a phone book. You know what? Why not just get a Playboy?
So I don't got no space. So we got, I got a 2 hard. Fine.
This is a lady who, you know, wants to start.
You got the phone?
Got the heart.
I got it all right here. That was a fat old dude.
You always got something to say.
You just, I got one.
Well, us.
No, let me tell you, how much those? Bought a new one for A? Library. I went on my own podcast. No.
Oh, you went, yeah, you dreaming. How about to say, you went down? Oh, you right, you almost perfect.
You know what? They also have to have medical experience before they let you in.
How about you go?
Because everybody wants to be an EMT, to make good money.
Hey, my wife told me they about to change it. They about
You're
to
gonna
change
be
it.
bored.
Maybe,
4 or
she
5.
said within the next 5, she said they already kind of going through legislation, they said they gonna change it.
4
Because
years.
it's
Make
too,
it longer.
because it don't make,
Yeah.
because it doesn't make, compared to what you have to do to be a doctor. Compared to like other positions. It's almost like a fucking.
Yeah, nobody.
Right. Unless you just want the extra money that.
Can you wait for my wife on with that job?
Where hell, PAs almost have a certain amount. Then they can't really do it. Some stuff they have to do. They
Bunch
still
of
have to
damn
have.
doctors started crying.
That's it.
Yeah, man, they want you to have medical, they want you to have like so many hours.
You can work as an EMT, you can work as an EMT for a year.
You could. 80% of our calls are medical.
You could do this.
So we're basically EMTs right now on transport.
Let me just say for the
I don't
So
know.
Dixon, check the phone.
You don't want to go to the studio.
I'm gonna keep up.
I already got everything.
It ain't gotta be.
I already got the medical, hands-on with patient and everything. I can just watch that.
Yeah, you can, but you know,
You don't want something new. See all the cases.
You got friends on there, so I can choose to decline.
Oh, you think it? Can I get Instagram?
it's a lot of. It's a lot of
Facebook?
if you find the right school, I got no.
You got a Google, right? You have a Gmail? That's social media.
That's a lot.
Social media that I live in the real world.
That's the best way.
No, I'm not gonna ever be no school. Nobody else? We already talked about
Only thing I be reconsidering, bro, is
I'm trying to get stationed in Tucker. Go ahead.
but I am too. I'm trying to even be. I'm trying to be.
No.
I'm trying to be in the South. I'm trying to be on motor cruise.
Go ahead, man. I like to see how far out you go.
Oh, we go far, bro. Done with it.
Laptop.
Done with it till I found it.
Got there, damn near stopped.
To the south, to the south.
Oh, man, you don't want to go to South. I mean,
To the
on like
southeast
Sandy
side, yeah.
Spring. Yeah, Sandy Spring.
Oh, yeah. You know that it goes almost. It goes a little bit like once you start partying, the mall and stuff. It's like a little small section.
Oh, you-
Yeah.
What they believe is.
There. Like it's a rhythm.
More house.
That's a.
It's cleaned up. It's over the man apartment. Yeah, it's actually more popular than Bluff Mountain.
That's why you over there talking like that.
I said, you know,
How'd you get it?
I don't, I had a scan tool that lets me scan and turn to a PDF.
You're gonna scan every single page?
Might as well. I got a jury. I'm gonna bring it to me, guys, but
I didn't get out of it?
no, I'm just saying, if I have to go somewhere, I don't want to bring a book.
I thought you got out of the jury duty thing though.
I did, I'm just using that.
They basically just tell Morris tough luck on the ebook thing.
I'm still working on it, he hasn't got back, because what he got back was the wrong version. It was an ebook for the B. So he might get some back.
So. Oh. Yeah, go ahead.
I didn't know you threw that out. I thought Harry threw that out. Oh, I still didn't know until you just told me. I thought he threw that out. My bad. I swear you threw that out.
But I was surprised I was able to cut those clubs like that.
I took a gamble and let you to see if you was gonna win the club. I said, you got. You did a couple more. You did a couple more bullets.
That's what saved this. What we have 5?
Yes. I didn't see anything really on your board. I'm like,
I had hella clubs. I just had no doubt. I had like 6 clubs.
all my cards, let me see, compare a 10 cup. I found that 5 reasons. Like high? Yeah, that's a blue tie too.
That's what I like to see. I just think you do that. I just love to see it. I love to see a skinny guy and a stout guy.
Stout? Wow. Hey, everybody thought talking because lunch was drink. Let's eat women.
Terminology.
What are you gonna do? You're trying to be a lawyer or something?
Nah, man, I just needed a degree.
Yeah.
That's easy to run.
He's interested in criminals. like Brad.
Want to know what made Bradley tick?
Yeah.
That's hard.
Greg, what are we doing on Sunday? Are we going for just 2 hours? Or are we going? I don't know. Is anyone else going? I don't know, man. It's like it's just me and you. Wakeboarding.
I got you 30.
I'm calling.
What is it?
Hold on.
It's gonna be more expensive for you because you're gonna have to rent everything.
Probably at 200.
No, it's not gonna be $200. Yeah, we can probably do under 100.
You said 1100?
No, under.
Oh, I said 1100.
3 Sunday.
Maybe.
Wakeboarding that thing.
Yeah. Huh? We gotta talk him into it. Doesn't sound like he wants to go. If you fall on like one of those ramps, it's gonna hurt. You're hitting a ramp.
Yeah, why would you hit the water like that?
It doesn't hurt that bad.
Okay.
I mean, you can knock the wind out of yourself.
I don't hear you, but I'll probably go all day, so I
We're not going for it.
No, there's a cable park up here. What did he call it? Emerson?
can.
Yeah. Yeah, I thought it was Cartersville, but it's termed as Cartersville. Middle, like, specific area.
Vessel.
It's off 75, like near all those like baseball.
It's only like
with traffic.
with traffic.
About 45 minutes to 50 minutes. I almost went after work one day.
Oh, what about Trey?
Oh, the Timmer's weight or weight part?
Yeah.
They got like beginner classes, or you go out there.
You just do it.
Oh,
Can't be that hard.
it's a free meal or person with a free meal or person with a weight.
No, that's on Friday. You want to go? You don't want to, you don't have to. I thought you wanted to. I do, for like how much longer is it? I mean, you get off 75, it'll probably take you 5 to 6 minutes to get to my place. Yeah, but like, how far is it? 30 minutes. 30 minutes. Yeah, I'll still meet you.
At 6.
Yeah, I was like, yeah, but when I got back on, that's in blue, and then it's like one message. And then I went back.
All right, let's keep going.
Schoolhouse rock.
Yeah. All right. So
So,
can you see the screen up there in Zoom world?
Yes, sir.
Good job, Ms. Quinn. Good job. All right, so we're going to talk about why understanding the sodium, potassium, and calcium things so important. Because it's all about muscle contraction. And when we talk about muscle contraction, we're talking about any type of muscle, including the heart. All right, so let's talk about sodium. And in this theory, I want you to think of sodium as an optimist, an optimist within the student population. This is the popular guy like Ferris Bueller. Okay, this guy can create action wherever it's located. Okay, he prefers to spend his time of day outside of the cell where it's fun to play outside. This is the football player, the baseball player, you know, the all-around popular guy. Probably trauma. So let's look at potassium. Now, potassium is a pessimist. Okay, even though he might. Okay, potassium is the person on the track team. Even though they get a letter to run track, they get to wear a Letterman's jacket, right? They still like football's the sport, right? I mean, you know, it's like the football players come up with the guys who run track and go, take that Letterman jacket, right? All right, you don't play. The only people that get away with running track are the football players who want to stay in shape for the football team. So who ran track? Raise your hand. I know I've offended half the class. I'm just kidding. Just a joke.
Yeah, but look at all the guys right now.
Yeah.
Metaphor.
All right. So I'm just joking. But seriously, so think of potassium as a pessimist. This is somebody who looks at the glass half full and prefers to spend their time inside. Right, inside the schoolhouse. All right, so let's look at calcium. Well, calcium is like the freshman coming in high school, right? They feel awkward, they want to fit in, they don't know exactly where they fit in, but they seek sodium as a means to fit in.
The freshman girl and the senior boy.
Pretty much, yeah. And so wherever sodium is, calcium wants to be. And so sodium's like, well, this relationship might work out pretty well because, you know, we could get calcium to open the door for us. Everywhere we go, we could get calcium to hold the door open. So they were like, so sodium, says, okay, reluctantly allows calcium to hang out with them and to facilitate opening any doors. Okay. So at the start of the day, all right, we have potassium inside the schoolhouse, and outside the schoolhouse we have calcium and sodium. Okay, remember calcium will hang out with sodium. Potassium's in there in the library, hating life, but inside. Well, if you have a schoolhouse, you gotta have parents. And no school is complete unless you got a bunch of unhappy parents. right? And so the parents are concerned that sodium is spending way too much time outside. I mean, they know their son or daughter, they know is a pretty good athlete, but they're not going to get professionally signed, right? They know this. So they want their kid to start studying more, and all they do is play football and baseball. So they want that to change. Well, the parents of potassium are like, it's not fair. I know he's not the best athlete, but he deserves some playing time. He deserves some play time. He deserves at least a couple of plays. Right? So they want potassium to get outside and do some more practice. So the parents, they call the school board, the Board of Education, and the Board of Education, who always overreacts to parents' needs and wants, because school board's elected. So they're going to do something to make the parents happy. They decide to hire a school bus driver. We're going to get a school bus driver involved here. So what the school bus driver is going to do is the school bus driver is going to come in the form of an electrical impulse. Okay? So the school bus driver is going to come in the form of an electrical impulse. So every time your heart beats, there is an electrical impulse. It boom, it beats. All right. And so how it's going to work is whenever there's more sodium outside of the school in comparison to potassium inside the school, the bus driver is going to tell sodium to move into the schoolhouse, and it's going to drive potassium outside of the schoolhouse. Okay? So when the bus driver gets there, he's going to say, hey, sodium, put the ball in, put it down, and get inside. And then potassium will be like, what's up? You come outside. Time for you to come out here and play for a little while. Your skin's shriveling. It's not getting enough sunlight. Come on, gotta get outside. And so that's what's going to happen. All right, so the bus driver gets there, comes in the form of a contraction. As soon as that contraction's over, electrical stimulus, he's going to tell sodium to go inside. All right, so here's sodium. They're lined up going inside. Who's holding the door? Yeah, Calcium's holding the door. All happy just to be around sodium. Smiling. So happy. Problem is, they're going to get stuck because here comes potassium. Potassium probably is going to be like this too. They're the doctors and stuff they study their whole life. Inside the schoolhouse, right? They're the ones who end up at the end of the day being popular. Yeah. Right.
So that's good. That's Derek Hall.
Oh, okay.
What's up?
So here comes, so that's right. So here comes sodium's made it inside. And so then once sodium makes it inside, potassium, all right, it's told to go outside. And then again, calcium stuck at the door. This is called repolarization. And so repolarization, what it means is it deactivates whatever physiological process that the school controls. Remember, cells are specialized. Cardiac cells, right? Liver cells, skeletal muscle, cardiac muscle, right? They're smooth muscle, right? Everybody needs to be able, all three muscle groups need a stimulus. And so whatever school the house they're in is what's going to control that. So if it's cardiac cells, it deactivates whatever that physiological process would be, which would be a contraction. All right, so that's repolarization, the deactivation. All right, so the job's done. School bus driver's headed home. the intracellular sodium looks around and realizes the bus driver is gone. And so sodium decides then to go back outside where all the fun is. And who goes to open the door? Calcium. Like, yes, sir, Mr. Sodium, I got the door. And so then potassium sees sodium on the way out, says, I can't wait to move back inside. They start moving back in. So this is called the return to the resting potential. All right, and then once the cell is completely finished and at resting potential, meaning sodium, all the sodium is returned inside. I'm sorry, all the sodium is returned outside, all the potassium is returned inside. Once that's done, then that resting potential is over. Then what is this in the form of? Right, electrical impulse. The electrical impulse school bus driver is dispatched back to the school to force potassium back outside and sodium inside. So why is this important to know? So let's talk about, again, let's look at the signs and symptoms again of hyponatremia, which is low what?
Sodium.
Low sodium. Altered mental status, seizures, an unsteady gait. What does unsteady gait mean? Walk. Yeah, you walk, you're all over the place. All right? And tachycardia. We see these almost out there still almost on a daily basis. Right? It's not because their sodium's low, but it could be. And that's called a differential diagnosis. We'll talk about that when we do patient assessment. So we talked about it already, actually. You know, if I think they're hypoglycemic and they have an unsteady gait and have altered mental status, my differential diagnosis, if I check their sugar and it's good, might be hyponatremia. All right, so then there's medications that are known to increase sodium levels. And so this is called angiotensin. It's a converting enzyme, ACE inhibitor. Don't worry about that. Actual ACE inhibitors, you don't have to worry about that. Medications to treat gastric esophageal reflux disease. Right? So those medications are known to increase sodium levels. All right, what about calcium? Well, some things that can inhibit calcium from opening the door for sodium are called calcium channel blockers. Right? Sometimes if a person has, a cardiac arrhythmia, they'll put them on calcium channel blockers. Hypertensive medications have sometimes are associated with calcium channel blockers. So that's important because if somebody overdoses or it's a new prescription, it's important to understand how that process of contraction works. So cellular action potentials have a direct effect on normal patient physiology, as well as those patients suffering from illness or injury. And these medications can be prescribed by a physician or administered by us in the field. So we have to understand how this physiology works. Go ahead.
By cellular action.
I'm sorry, being by what?
Cellular action.
That's what we just talked about. That's what's that for us. That's cellular action potentials. Right? So that's why it's super important to kind of understand how potassium, sodium, and calcium play a role in that process. Does the schoolhouse thing kind of make it a little easier to kind of deal with? All right, good. All right, excellent. Because now you got an idea of kind of what it does.
This on JBL.
I'll put it on JBL. It's on YouTube now. Our last look, I think we had about 700 followers watching live stream. Can't believe 700 people want to sit here all day and watch class 117.
It's just, I feel like it's interesting now.
It's because of Maze.
Is it Maze? He's popular?
It's his game thing.
It's gerbil.
Maze,
Yes, sir.
got a question.
Sure.
Do you have 700 guinea pigs that watch YouTube?
A judgment question.
What did he say? He said yes.
Yeah,
He
just
said
like-
yes.
Okay. All right, good.
Don't forget to take him on a walk with you.
JJ, I'm gonna beat you.
He said beat you. All right, does anybody have any questions on what we've talked about so far? Basically, it hadn't been too bad. I think Instructor Lillard's jealous. That's why he didn't like to put that on for me, because that's my slide program, and he feels like since he didn't come up with it, didn't have the knowledge, or I don't hold that against him. I don't hate on him because he can't think like that, Right. I'm just kidding. He's I hate to say it, but he's more intellect than I am. Yes, well, that is exactly right, Greg. So glad you brought that up. I am the sodium in that relationship. He has always been potassium. Yeah, well, he's always right, and calcium. Even when we were at the station, we get a call. He would have to open whichever apparatus store I was on, and then before he even got his, so he had to really hurry when the bell rang. I'd be like, I would just look at him, but he wouldn't even look at me. He would just run. Right? He would just run. I'd be like, yeah. Get out there, open the door. All right, well, good deal. All right, I don't want to start anything yet with 10 minutes left before lunch. So if y'all can't entertain me for 10 minutes.
Maze, pull out your journals.
Oh, hang on. Maze, where you at? I don't even see you. Hang on. I am. Ken. Maze. Maze. What kind of response vehicle is that back there?
So that was from my old department. That's a 1996 H1 Hummer with a 6.7 liter Cummins in it.
Maze, I got a question for you.
Sure.
How many lug nuts are on that tire of that vehicle there?
How many what now?
How many lug nuts?
Oh, you've already failed. You already failed.
Oh my God. You don't know your apparatus.
So many. We had to change the tire during a snowstorm. We had like
You should definitely know that.
2.5 of snow out. It was terrible.
Yeah. That's a pretty expensive vehicle, man. A Hummer?
Yeah, it's pretty
Colorado
sweet.
money.
Oh, that's Colorado money.
Oh,
Yeah, we get it.
Wait, how many fires did that thing respond to?
yeah. 0.
Stack.
Hey, do not pull a JJ. I will come down there and infect you.
He said what? He said, where's the 1 3/4 line? Is it in the back?
Yeah. Yeah, you got 2 doors in the back you open. You got your pre-connects. You got your 1 3/4 with your 7/8 tip and your 2.5 with an 1 3/4 tip.
Okay, cool.
Straight stream, baby.
All right.
We don't do fog nozzles like y'all do down here.
Well, you know, we like to feel the heat down here a little bit.
Okay. Yeah.
We like to get a little hot.
Gotcha.
Okay. Okay. Yeah. I love that thing does look sharp though. I'm gonna give you that. It looks good.
Now, if you need some water, we got this boy right here.
There we go.
It's ugly.
Yeah. Mace, did you show up in your blue jeans and your t-shirt that had, you know, volunteer station 43?
No. Dress to impress, baby.
It looks good. We got a tanker here though, believe it or not.
Yeah, I saw that.
That was it 17?
He wants to go wherever the wild.
Nines.
The wildland fire? And the wildland.
Those things like tip really easy though.
Yeah, they're a major problem. They're like the most common vehicle to be involved in an apparatus over.
Yeah.
You can fit a lot of gerbils in that
All right, well, we better go to lunch. All right, so let's go to lunch, Maze and Gwen and Hicks. We'll come back at 12. I'm sorry, at 1300. I don't know why I just want 12:30 so bad with you guys.